I'm honored to discuss an excellent publication by Dr. Cason et al. On preventing hump recurrence in dorsal preservation rhinoplasty. This work is an anatomic and technical masterpiece describing advanced DPR strategies. DPR is a technique described in the late 1800s that has gained renewed interest as complications from traditional rhinoplasty have steered surgeons towards preservation-based approaches. DPR is subject to an up to 15% dorsal hump recurrence rate, which typically requires surgical correction. The authors employ here the well-organized algorithmic approach of Dr. Roerich that is augmented by the beautiful anatomical contributions of Dr. Cotofana. The premise of this work is by following the 5 described tenets, one can minimize the risk of hump recurrence in DPR. By reviewing patient selection first, the authors force the reader to review critical anatomy and precise assessment of the rhinoplasty patient. In fact, perhaps the most important aspect of the manuscript is that by reviewing highly sophisticated and intricate surgical techniques, it forces one to think critically and to question one's own work, whether one performs DPR or not. The anatomical figures and anatomy described are excellent, even for those who are not focused rhinoplasty surgeons. The authors highlight the significant challenges and limitations of DPR, with fewer than 40% of patients being candidates. And for those who are, the anatomic blocking points, which are well delineated here and not insignificant, must each be addressed. For readers with less finesse in rhinoplasty, perhaps the most technically challenging portions of the manuscript are the procedural selection and ancillary procedure sections. This is not unexpected, however, given the complexity of the subject matter. Despite this, the 5 tenets highlighted are logical and the descriptions flow seamlessly. Overall, this work is positioned to become a classic. It is meticulous, elegant, and algorithmic. Its sophistication exudes a deep understanding that is positioned to advance the rhinoplasty field. Its benefits are geared towards rhinoplasty aficionados and may intimidate novice plastic surgeons, a worthy goal it meets and exceeds. Congratulations, Dr. Cason et al. For this superb work.